So joining us to talk more about prostate cancer, screenings and staging, urologist and director of Men's Health Services at Cook County Health, Dr. Florian Strohe. Thank you for being here.
Thank you for having me. It's a privilege and an honor.
I think a lot of people are surprised at how advanced this cancer is at first diagnosis in someone who would presumably be getting regular checkups every 6 months. So does the PSA work in detecting cancer if you're getting the test regularly?
The PSA is really one of the best screening tools that we as physicians use across all disciplines of medicine. And the PSA is a very good test. Without knowing the full details of former President Joe Biden's case, it's hard for me to really go into those details of when screening was and how it was done. But I really just want to impress upon you and everyone listening that prostate cancer screening is really much easier than you might think. It's quite simple. I'm happy to discuss what that entails. And it's something that we have, national guidelines and recommendations on when to start prostate cancer screening so that you don't wake up with a surprise or with a shock such as this.
And we'll talk about those in just a moment. But first, I want to talk about progression. So what does an elevated PSA mean? And what does the progression look like from the time that you may have an elevated PSA to it potentially spreading to the bones and maybe beyond?
So an elevated PSA is really very subjective based on what your prior PSA tests are, what your subsequent PSA tests, how frequently it changes, and to what extent. And then we take that into the relationship of how big your prostate gland is. And so, depending on the patient's age and the size of their prostate, an elevated PSA test can be different from one individual to the next. Generally speaking, when you're going in with a PSA level in the 4s or higher, but certainly sometimes lower, that does raise a little bit of a suspicion that a little bit more evaluation would be warranted.
All right, so who should get screened and at what age?
So our national recommendations recommend that all men, certainly between the ages of 45 to 50, we recommend prostate cancer screening be started. Now, if you have certain risk factors such as Black ancestry, you have certain mutations, or you have a very strong family history of prostate cancer, then we generally recommend we start a screening just a little bit younger, which would be at around the age of 40.
So what are the possible treatments if the cancer is caught early, and then potentially what would the prognosis be?
Certainly. Now, in the situation of our former President Joe Biden, he has what we describe as metastatic prostate cancer, and so ultimately that's an incurable disease. However, prostate cancer, generally speaking, if caught earlier on, is quite treatable, and really the treatment options. There's a subset of prostate cancer that there's a lot of discourse within the medical community that shouldn't even be classified as a cancer because it is quite common and it is what we refer to as low risk or very low risk prostate cancer, where we keep active monitoring with the patient, but a treatment option is discussed but not necessarily recommended right away. Now, if treatment is recommended, generally speaking, those options are going to be a radiation therapy with curative intent or a surgery, what we call a prostatectomy, to remove the cancerous gland, again, with curative intent.
Doctor, do you think there is a stigma to the testing and potentially the side effects of treatment that might be keeping men from getting the test? And I guess the question is, why should they not worry about that and worry more about finding the cancer early?
Absolutely. A certain stigma, I think we see, and it's the nature of why we see an uptick when situations such as this arise on the media outlets, and we see more and more patients around this time come in for their PSA checks, and then folks sometimes tend to forget, and then another event will happen and folks will come in again. Do I think that there is a little bit of a stigma? Yes. Do I think that a prostate cancer screening is simple, easy, painless? Without a shadow of a doubt. And so I really want to go back to the basics here, and I really want to impress upon any man or any person listening to us right now, link with your primary care physician, link with your urologist, and talk about, hey, what does prostate cancer entail for me? How can we stay on top of it? And how can we make this as much as of an enjoyable process as we possibly can, while still doing all the appropriate workup?
It's a great message that could save lives. Dr. Stroe, thank you so much for joining us today with all of that information.
Thank you for your time.